Hi viewers, another episode of Guest with Nazir. We are honored. Today's honorable personality is a doctor. He has done a lot of charity work. Today we will discuss his early days, his education. Welcome Dr. Hafeez in our show.
Okay, thank you. Thank you.
Abdul, please tell our viewers about your childhood and your early education.
I was actually born in district Faisalabad, one of the remote area of this district, and my early education was in a government school, and this was a kind of a school where you will not get any desks, and we were sitting on the tarts and so on. But obviously, that school has given me an insight into how the world is on the other side, as opposed to what my children are now experiencing while in the UK. Obviously, from early age, we were taught the work ethics and hard work, and our parents paid a lot of attention in terms of our needs and how to excel in our careers. And obviously that mental resilience which you get from that age stays with you. And then obviously we moved to, in a high school, I moved to one of, relatively posher schools in Faisalabad city. And obviously from that school obviously gave me a lot as well. So Dwidal Public School in Faisalabad in those days was one of the best schools in that particular city. So obviously from there on, I went on to Government College Faisalabad and then moved on to Karachi, where I studied for my medical degree from Aga Khan University.
Completing education in Pakistan and then completing house job. So at what stage you decided to move to United Kingdom?
At quite early stage, obviously, as I was completing my degree, I had very clear plan in front of me in terms of how I will go from undergraduate to towards a postgraduate qualification. So the UK destination was very clear in my mind. So I moved here at the same time around house job, and rest of my undergraduate, the early junior doctor training. This all happened within United Kingdom. I have the facility that part of my family was already here, which actually helped me. However, obviously being a doctor, it's a very different world. And when you go to a new system, and obviously you need a lot of guidance, a lot of help. And it's very easy to make mistakes and waste your time or do some things which will take you nowhere, essentially. So that's what happened. Obviously, I came here and there was a bit of a struggle in the beginning because I felt there wasn't strong guidance available for junior doctors at the time.
So you have to complete PLAB, or you did your further studies and then start practicing as a doctor?
I did my PLAB, obviously in UK, and obviously then I started my house job again, which I did in UK as well. Though I've done house job, partly in Pakistan, then we have to just take a step back and restart the process. So that's what happened at an very, very early stage. I've been in the NHS.
The government has made now the tough rules about the conversion exams and also requirement of very high level linguistic requirements. So do you see that in your time and present age, there was a difference exams, or it's the same thing?
I think the exam has gradually changed. I think the exam, when we were doing, we felt the exam very tough. However, obviously they have changed the bar even further. What happens is obviously UK is an international market, and people from all over the world come to this country for postgraduate qualifications. I think I have met doctors from, I would say, nearly 45 to 50 countries. And when you're competing at an international level, obviously then you have to be best. And when they have the choice in terms of picking the best, then they can raise the bar and still get enough number of doctors which will meet the requirement of the NHS. So that's what happens. Obviously, I do appreciate the English language exam has become very tough now, as opposed to what it was before. But that's why GMC has now introduced a new kind of exam, which is called OET. So obviously that exam people find a little bit easy than the previous IELTS.
NHS played a very vital role in recent, the pandemic, and especially I will say it's like a situation of emergency. And a lot of frontline doctors have, I would say, sacrificed with their lives for the sake of the British public. But in during that time, a lot of things been and question been raised. So, what was your viewpoint about the safety of the doctors and all the supporting staff?
I think this pandemic is one of a century event. The previous pandemic, which we heard or read, was the Spanish flu, which happened nearly 100 years ago. So nobody was prepared. And obviously we had in the recent past, Ebola outbreaks and MERS and, some other kind of swine flus and so on. So we always felt this is not going to come to us. Obviously, this is somebody else's problem. And this COVID, all of a sudden, the pace it spread, it actually really brought the world health systems to its knees. And obviously, we were one of them as well. So not knowing what to do, how to prepare, what is the right thing to do. There were a lot of uncertain situations, not knowing how this virus behaves, not knowing how it will actually cause problems. And then at the same time, while we are trying to do your best for your patients, obviously how you protect yourself, how you protect your staff. And there were obviously severe shortages of PPEs. So all these issues combining together, it has been one of the toughest time in my life, at least, where obviously when you go to work, you have this stress at the back of your mind. You don't know which patient will be spreading virus, and because you're like in a war zone. And when you come home, your family is worried. Your children, you want to keep your distance. Your parents, you're not seeing them. So it's been extremely tough in terms of how we have coped and how stressful things have been, not only just for doctors but obviously for the whole country. People have struggled financially, jobs, there has been so much stress, and then it has a severe implication in terms of mental health. And especially talking about our community, Pakistani community, I noticed, because we have a more joint family system where few generations are living together in one house. So that was an extra burden. Then being an Asian, obviously statistics did show that we are at a higher risk of catching the virus and dying from it. And obviously we know so many of our friends, colleagues, people we know, in our communities who have actually passed away with this illness. So it is a huge mental toll, not only on us, but especially Pakistani community, where people have language barriers and they couldn't really get the right kind of information which they needed at that stage. I mean, things are getting better now. We have a little bit more time. Scientists have done some research, and we can actually see what this virus is like. And the vaccine came out, and so lots of things have happened. So things have improved, though we are not out of the danger as yet. But yes, it has been an extremely challenging year.
Abdul, what do you think? The different variants are coming. Recently, the whole world is facing the Delta variant, which is very dangerous also. So what is the difference between the previous variant, which is known with the name of certain countries, but here now we are on the verge of another challenge, which is very, very dangerous. So what you will suggest to our viewers, that what precaution they should opt?
Essentially, this is a virus which has caused havoc all over the world. And if we, just look at the size of the virus, it is so small, that we can't really, really even imagine that size. And if we actually weigh the total virus, which is all over the world, I don't think it's going to be more than 10 grams. in terms of total virus which has spread all over, which is equal to 2 flies, you can say. But obviously, the virus itself has a survival battle as well. So human beings, on one side, we are trying to contain the virus, but for this virus to continue its life and its generations, it's actually also trying to fight, because when we are generating, we are producing vaccines, we are using antiviral drugs. So all these different activities which are happening are putting virus in a danger, of extinction. So essentially, the virus, obviously, because it has gone its own very clever way of protecting itself. So it actually brings changes into its genetic material. And so from time to time, obviously, different virus, depending on if a patient doesn't have enough immunity and they can't fight, or certain patient can fight. So these changes in the genetic material are quite natural. And having one change to second change to third change, we have seen it obviously over the last few months. There have been so many different variants, and then the double variant and all those. So essentially, any future change means the virus is trying to escape the defenses which we are trying to build. And in that process, obviously, the new virus, what we have found, is actually spreading faster. It's causing more severe illness and more aggression in terms of how actually affects the defenses of the body. So Delta virus, again, is one of those changes which luckily we have detected. We know how damaging it has been in India, and the pictures which are on the social media, though the mainstream media may not have shown all the havoc which has happened. But again, unfortunately, the response from all governments was very slow, and there was a lot of traffic between India and other countries. So that's why the virus has actually spread all over. And when the virus has actually changed, our defenses are not as effective, then virus actually can kill more people, and especially people who are not vaccinated, they are in a severe danger. And I know, we were trying, and we've done few programs with you as well, where we actually suggested people in terms of how to protect themselves. Then we did programs in terms of why people should get immunized and so on. So that's the only defense which we have. And in our community, the response to vaccination was very slow till this Delta virus came in. And when the statistics came out, obviously that we are heading towards third peak, then a lot of people did come out. So obviously we are seeing a better response, but still there are still a lot of theories going around which are suggesting that this is some sort of conspiracy, and we are trying to try to control people and so on. But yes, obviously there are some very senior people in the scientific
These are the rumors.
world.
There is no certain research or not scientific backup, any data or something. Now I will move for another very important question. Especially in the United Kingdom, the government is going to relax some restrictions in coming days. And obviously a lot of viewers are watching our show. Obviously this virus is still there. It is dangerous. Situation is still same. Yes, there are some statistics that the government has arranged some very fast vaccination. But again, what are your suggestions again, especially in the prior to the relaxation of this restriction and after that? So what are the precautions you will suggest, especially people who travel, people who are going to join the workforce? So what precaution they should opt?
Just interestingly, that question brings me an important point. When the pandemic started, February last year, I produced some guidelines for GPs. And obviously we implemented these guidelines in our own GP surgery first, putting a line on the floor and keeping the distance, keeping the windows closed, no contact between the patient and our receptionist, all of them wearing gloves. At the time, there was no guideline in UK. which suggested all these activities, and people thought we are crazy in terms of why we are doing all this. And then obviously that work which I did at that stage, obviously I felt that's the way forward. And if we are going to protect ourselves and especially our staff, we have to keep the distance between the patients and only essential contact. And we started triaging patients even before anyone else started doing this in UK. We started taking histories on the phone and then obviously bring the patients for examination only if they really have to. So this activity obviously was recognized. As you know, I was given MBE for that kind of work for the NHS. And similarly, because obviously we are at another stage where government has its own priorities. And obviously there is economy on one side, and obviously running the country and then protecting these people's lives and protecting the NHS. It's a balancing act. The statistics are showing that even if the number of cases are going high, and even when the restrictions are still in place, I mean, as you can see, we have nearly 50,000 new cases diagnosed. But what is important to note here is the people who are vaccinated, they are at much lower risk of hospitalization. Obviously, it's not 100% protection. Obviously, we are not at a stage where we can say once you're vaccinated, it doesn't matter whether you catch the virus or not. So that's important point. The previous strains, there were some protections, but this strain, obviously, there are patients who have been double vaccinated, but even then they get illness, and some of them get real severe illness. Obviously, from government point of view, this is good enough. There is a herd immunity. Some people actually caught the virus and they got antibodies, and some are getting it through the vaccination. So it is a very bold step from the government, I must say. But obviously, it is backed in terms of the cases which we have seen, the hospitalizations, as well as especially intensive care admissions, which are quite low at the moment. And government hope this will stay like this or not go too far high up. However, what I would suggest is the relaxation of the mask. Obviously, government has its own priorities, but we have responsibility as citizens. Obviously, we have to protect, number one, ourselves, protect our families, our loved ones, and then our staff, then our patients, all those. And then if you're working, your own employees and wherever your customers and so on. So my advice will be, so even if it is not compulsory, the organizations like NHS and some other organizations are proposing that if a patient wants to come and see a doctor in the hospital, they should continue wearing masks. And similarly, the doctors and the staff, we will continue, keeping the PPE in place. And because this is a high risk activity. So this just tells us that this is not we are not out of the danger zone as yet, and there is no guarantee this Delta virus will not change further. And if there is any further change, and when that change happens, so we don't know. And in terms of the implications and whether it will be protected by vaccination at all or not, so it's so much uncertain situation. So I mean, obviously, I would suggest we should all be very sensible. Eid is coming, so obviously, I would suggest when you are, going to meet your family and friends, please do keep the distance, keep the mask, especially if you're in a crowded zone, especially people who are elderly with underlying medical problems. My strong advice will be, you need to take action and protect yourself. I think that's the way forward for the time being. And as we move forward, things will be clearer. And I'm sure eventually we will be out of it, inshallah.
Abdul, because of the time restraints, I will quickly ask about your organization, because you set up organization and you have a very large number of professionals in it. So please tell our viewers briefly about your organization and how it is working the patient and the NHS here in the United Kingdom and also abroad in Pakistan and so on.
As I said before, when I came to UK, there wasn't much support network for Pakistani health professionals here. So I launched Association of Pakistani Physicians and Surgeons of United Kingdom, also known as APS UK. This was back in 2004. So obviously the network which we have generated. Obviously, it has now become a global name. There is a huge, support when available for doctors between, different countries. Last year, we launched apps Europe. One of our friend, Dr. Shahid, he's the president, and obviously he's the founder of apps Europe. And then very recently, a few weeks ago, we've launched apps Middle East and apps China. Obviously, it's on the way in another 3 months' time, 4 months' time. And this is now becoming a global platform where Pakistani doctors can move from one place to other, and get support. I know there has been examples where somebody moved from Middle East to UK, got accommodation, knocked on the door, obviously with family on that particular day when they landed at the airport, and to find out that the accommodation doesn't exist there or the person has changed mind. And now this person in the evening on the street, nowhere to go. And there are many examples, even during pandemic, we have similar situations. I just remember something very interesting. There were a lot of doctors who got stranded in UK when the flights were closed. So these people who were visiting UK, staying in hotels, and they had nowhere to go essentially when the flights were closed, and they were, obviously we were not clear when the flights will reopen, and they had limited number of funds, they had no family. So all these people, obviously, when they try to look for help, then organization like Apps UK was in front of them, and we were able to help and guide many of these students. We have financially sponsored them. I remember a particular situation where somebody informed us that there is a lady doctor who is struggling and she has no support. So when we contacted her, she said, forget about me. There is another doctor who is staying in a bed and breakfast and he hasn't paid. And then he has only 15 pounds in his pocket. So obviously, this is like a real example without going into any further details. So Apps UK stepped up and we actually paid for their accommodation. We provided food. So these are just big examples, but obviously there has been hundreds of people who,
as an organization, because of the time restraints. So one quick question: you are also helping the students who are interested to. This is very critical, and I say very crucial role your organization is playing for the students who wants to join in future medicine as a profession. So please quickly, because of the time restraint again. So how you are helping the students?
We, as an organization, obviously we have very big number of projects which we are working, but the one which you highlighted, obviously this is to help our A-level students who want to do medicine in UK. For past few years, Apps UK has been running interview skills courses for them free of charge. Last year, because of the pandemic, their work experiences got cancelled. So Apps UK came up with this idea of having a virtual work experience, and nearly 500 students actually signed up for that particular project. And these students were not Pakistanis only; they were from India, Sri Lanka, from even the local communities, ethnicity, all ethnicities were represented, and we were able to provide them quite a comprehensive work experience. Following on, we also organized interview skills course. 2 years ago, when we actually launched the interview skills are to enter into medicine. Our success rate was 100%. So all 12 students who actually joined the course in the first year were able to get into medicine. Last year, we again had a very high 87% success rate. So, and I think we haven't got the figures for the last year, the current year, which we are at the moment. But yes, we are continuing to help our young generation, especially the people from Pakistan who are kind of at a disadvantage, and many of them do not have any medics in their family. So we actually help and guide them to enter into medicine and change their lives, obviously their life and their family's life.
So you're giving them an insight of the profession technically and what is the preparation. So in last question, I will request, please elaborate your services, especially charitable projects your organization and yourself is doing within different societies, especially during pandemic. I remember you were sending some equipment to Pakistan, especially the ventilators and the PPE.
Yes, I think there are so many different projects. We were one of the first organization that started doing webinars. These webinars, which our organization did for doctors, we had interest from all over the world. I think our data shows that some of our webinars were watched by doctors in 27 countries. Knowing, obviously, there was no other organization in UK who was providing this kind of service, and people wanted to know how UK doctors are treating COVID patients. So there was a huge interest. Then, obviously, we felt, as you know, there was a severe shortage of PPE, and our members were even asking us to help them. So we actually commissioned PPE through different sources. We brought the PPE here. We also sent PPE in Pakistan at a time when it was desperately needed. In addition, we obviously started raising funds for ventilators. At a time, again, as you know, you have been actually campaigning with us on that particular area when there was a severe shortage, and it was a matter of saving someone's life. So obviously, we raised funds for ventilators, and in addition, obviously, within UK we have a lot of activities going on. Our foundation wing is very active in terms of providing the food to the vulnerable people. Our president, Mr. Shakil Puri, at the time was very active in terms of supporting patients or people who were living alone in UK. And when you're in a lockdown, you do not have a family and you have no one to turn to, and you need someone to actually do shopping for you, provide support, guidance. When you're alone, you just want to speak to someone and get that pressure released when you know your family members are admitted in hospital on ventilators. So we've been providing support to all those many families, and we have many success stories in terms of how we are doing.
Dr. Hafeez, thank you very much for joining my show, and it was always a great honor to have discussions with you. In coming days, we will take you again. Thank you very much. Viewers, this was our honorable guest, and at the end, we will also congratulate him from the community and from our team that he has been conferred MBE. Dr. Hafeez, congratulations once again, and thank you very much for joining me.
Thank you. Welcome.